Hello and welcome to Kotak Chat Room presented by Kotak Securities. I'm Indu Chaudhary. Today, a very special guest is joining us, Dr. Ramesh Kancharala, Chairman and Managing Director of Rainbow Children's Hospital. Sir, pleasure to have you in the show.
Thank you very much. Thank you. That's very kind of you to introduce me.
Uh, please give us a brief overview of this IPO and what its major objective is.
So, the Rainbow Children's Hospital is a 20-year-old children's specific healthcare organization. And we have been running our operations and expanding into multi-city. And today we are in 6 cities with 1,500 beds. We have investor CDC, which CDC is a UK government-owned private equity arm. So they have been with me for the last 9 years' time. So there is a mandate to give an exit to the CDC, uh, and also kind of a this is the only children's hospital of that size in this country to looking forward kind of a future to build a healthcare for children.
So, any plans to establish new hospitals and clinics or to increase the occupancy, bed occupancies in the near future?
Through the IPO proceeds, what we plan to do is that so we want to add more number of beds, about 500 beds in the next 3 years' time, in the cities where we are already existing, like in Hyderabad, Bangalore, Chennai, and moving forward in future that make it more robust hub and spoke model in these cities. So to have a kind of a hub and spoke model has been a very successful for children's healthcare that we demonstrated in Hyderabad. Though we want to take a similar approach in Bangalore, which is tracking very well, and Chennai and NCR, New Delhi also we are envisaging a similar expansions in future.
Yes. So, sir, I wanted to understand one more thing. This hospital is offering almost every facility. It's like a supermarket for where you can get each and every facilities. So, could you please elaborate what kind of special facilities that the company is providing, especially for the childrens, and what is your future outlook?
So this is the children's hospital which offers a complete end-to-end care for the children. So right from what our aim is to kind of right from the first heartbeat in the pregnancy, in the pregnancy confirmation till the 18 years to give a complete healthcare services and solutions. So what we have actually seen is my background is that I'm a pediatrician, done a pediatric gastroenterology, liver diseases, and liver transplant. I spent about 8 years in United Kingdom, working in one of the world's largest children's hospital in London. So with that experience, what I've realized is that child-centric hospital, children's focused hospital, and also offering everything, all the specialty services for children is an essential. So with that vision, I've come back and saw an opportunity in Hyderabad to start a children's hospital. So it's the two conceptually two important things to establish children's hospital. One is that hospital has to be absolutely child focused hospital in terms of environment, gadgetry, overall the service provisions. Second thing is doctor engagement model. Unlike a multi-specialty site, children's hospitals are 24 by 7 because we quite a lot of times we get admissions 24 by 7. Most of the admissions perhaps comes to the odd hours because in emergency based specialty. So the your doctors got to be a full-time doctors, and also they have to have a commitment to the night on calls as well. So this is a unique model, which is actually any children's hospital across the world works in the similar model. That's what we conceptualized and actually nurtured over the period of 20 years time. We were able to kind of build an excellent services for children's right from kind of a primary care to secondary care, tertiary care, including offering the organ transplantation like a liver transplants, renal transplants, and bone marrow transplant to the children. So this is what we envisage to kind of build a solid, strong platform for the children's healthcare, across the country, wherever we are, especially in the cities where we are in Hyderabad, Bangalore, Chennai, and New Delhi. And also, we also always believed in childbirth is best place to have a childbirth is in Children's Hospital because it's the MCH, Maternal Child Health. It's a good old model. So the having a deliveries in a children's hospital is much more safer because there is already children's ecosystem environment. So intensive care services are there to support you for the newborn baby who requires any sort of intensive care. So we built a very strong perinatal services to take care of the kind of a normal mothers as well as the high risk mothers. So comprehensively, we are a multi-specialty pediatric healthcare along with the maternal focus with the high risk pregnancies.
And so, what kind of growth are you expecting for financial year, like till 25?
I think we have been actually growing in the past, kind of around 20% growth in the past, but right from 16 to 20. What 21 is aberration because of the pandemic year. So pandemic year, the children's healthcare has taken a huge hit because of children being at home and no schools, no travel, any of those things. And we expect it to come back, pent up demand for the current year, 23. And also that we as we were growing in the past, we continue to grow in the similar fashion.
Sure, sir. So, any plans to increase or to expand your business, the hospitals, to other parts of India as well?
We have definite plans to kind of increase our footprint in the NCR area. That's another after South, another larger area which we are going to look at. A larger footprint is in NCR. We have a plans to kind of explore opportunities in the Northeast. Why Northeast? Because lots of children from Northeast coming all over the country for the medical treatments, the surgical as well as medical treatment. So those 7 states are seriously deprived of the children's health care. So we see an opportunity in those areas, considering that our capex and those things we optimize. I'm sure the Northeast is definitely one area which is in our radar, which we actually started doing a diligence on the area to come up in few years time. I think it's a bit early for us to kind of look at ambitiously. We have a lot to do within our country with the geographies where we are operating now, and also within the country our business plan. Obviously, that if there is a opportunities comes in future in a longish term, we would be kind of consider those things, but not in the near future, near term. In the 5 years, we have a fairly, you know, uh, we are kind of very confined to the areas where we are uh, operating.
Sure, sir. So thank you so much for joining us, and it was great talking to you. And we wish you all the best for your
Thank
uh,
you.
journey.
Thank you so much, Mr. Thank you. Thanks a lot. Thank you. Thank you.
Investments in securities market are subject to market risks. Read all the related documents carefully before investing.